Hello and welcome to the next episode of the Psychedelic Medicine Podcast. I'm Dr. Lynn Marie Morsky, your guide on this journey. And this week, we're going to be discussing combining ketamine therapy with other modalities with Dr. Genesee Herzberg. Dr. Herzberg is a clinical psychologist and co-founder and director of Sage Integrative Health, an integrative psychedelic therapy clinic and training center in the San Francisco Bay Area. She worked as a therapist on the MDMA for PTSD clinical trials and co-edited the book Integral Psychedelic Therapy. Now, before we get to Dr. Herzberg, just a reminder that the Psychedelic Medicine Podcast is for educational and informational purposes only. Nothing here is to be construed as medical or legal advice. And just a reminder, if you are a clinician and you would like to learn more about psychedelics, perhaps your patients are asking you questions and you'd like to be more informed, please check out the Psychedelic Medicine Association. It is our mission to get you up to speed and informed and feeling comfortable and confident to have discussions about psychedelics with your patients. You can find out more at psychedelicmedicineassociation.org. Now, without further ado, thanks so much for joining us today, Genesee.
Thanks, Lynn Marie. Really happy to be here.
And I realized before we started recording, I did not verify that I was pronouncing your last name right. So did I get it close?
You got it. Yeah.
Yes. Okay. Excellent. Excellent. Well, I'm really excited to have this discussion because before we started recording, Dr. Herzberg and I were talking about some of the things that they do in her clinic, and we've touched on some of them in other episodes, but maybe not so directly integrated into a ketamine session. So I'm really interested to take this one step further. And on that front, let's start with somatic therapy. I know you said that so we're going to be covering a number of different modalities, and somatic therapy is one that longtime listeners will know we covered as kind of like a preparation and integration modality, but not something to be we have never discussed its use in the session. So can you talk a little bit about how at your clinic somatic therapy is used within a ketamine therapy session?
Yeah. And I'm excited to talk about this one first because it's such an integral part of my work with ketamine therapy and also many of the practitioners that I work with at Sage. I see the body as holding a lot of the remnants of past traumatic experiences that we have throughout our lives. It, certainly can reside in the mind as well, and it can show up as everything from flashbacks to nightmares to avoidance. We probably have some sense of what PTSD looks like. But one of the major symptoms and ways that it's expressed is through the body, and that can look a lot of different ways. It can look like contraction or tension. So many trauma survivors experience tension in their bodies, tightness in their chest, contraction. It can look like a sense of being disembodied or dissociated, and many other things as well. And I'm going straight to trauma because, in part, I find that almost everyone who comes into therapy has some sort of trauma in their background, and I would say just being human is inherently traumatic on some level. And so it's an area of focus for myself and for my clinic and other practitioners there. And having a somatic or body-focused approach is really, really helpful when you're working with trauma. And so, in the ketamine session specifically, since you all have talked about how that can show up in preparation and integration, in the ketamine session, it can look a lot of different ways. One piece that I'll mention first is that I see ketamine, especially at lower psycholytic doses. So, we're talking about maybe 100 milligrams sublingual or so, as a support in turning down the volume on emotional and physical pain, which can then help us to better experience them. So I think of it as a sort of re-associative. So though ketamine is a dissociative, it gives us distance from our body, from our feelings. It also can help us make contact with emotions, with trauma, with bodily sensations that previously had been dissociated or too much to feel. And so our psyche pushed them out of our awareness. And so as ketamine helps us to sense into things that were there, but we were not aware of them, we can start to gain awareness of them. We can start to process them. We can start to move them through. So a somatic orientation will help the clients to bring awareness to their bodies to notice what's coming up. And we're doing some psychoeducation around this in the preparation phases so that people know to be looking out for what's happening in their bodies. And then bringing their awareness there. So, say, for example, someone is feeling a constriction in their chest. Then we would, ask them to let us know. Sometimes I'm even asking people what they notice in their bodies, and then support them in bringing their awareness there, breathing into it, and then opening up to whatever communications that part of them wants them to know. And there's a particular technique that I often use called focusing, or Eugene Genlin's technique called focusing. And it involves exactly that, bringing your awareness to a felt sense, listening to it on a sensational level first. How does it feel? How would you describe the sensation? And then opening to whatever shows up. You're not looking for answers with your mind. You're more opening to, are there images that are showing up? Are there memories? Are there emotions? Are there sensations? And just allowing whatever is there to come through. It can take a little practice to be able to do that. But with the ketamine, often people have less linear thought happening anyway. And so it's a lot easier to just kind of free associate to whatever is coming up. And often that is a really supportive part of the healing process. A touch is another thing that we can talk more about. It's another aspect of somatic therapy that, yeah, I can get into in more detail, but I'll pause there for now.
Okay. All right, we'll get into that next. And I wanted to, because if anybody heard our last episode on somatic therapy, they will know it is my favorite thing. I am a giant fan, the only thing that works for me. And as you're describing it, I'm remembering what it was like to be in those first sessions thinking like, I'm not going to be able to come up with these images. And like you said, it does take some work, but now that like it's just I cannot give a higher recommendation to this, for maybe not for everybody, but if you've done
Mhm.
therapy and you're like, I still feel like something is sitting in my chest. I love that you use that example of, some like tension in your chest. It's so relatable. And I
So
was
common.
wondering if the ketamine, because one of the, challenges can be that while you're the patient undergoing this, your mind still is doing the mind thing, right? It's still like
Mhm.
using words and as it may lose focus on the sensation. Does ketamine tend to help people stay in that kind of like interesting, because for me, it seems like a quasi hypnotic state that
Yeah.
you're put into. And I imagine ketamine being as though it's an altered state of consciousness maybe helps them stay in that a little better.
Yeah, it does seem to quiet the monkey minds. And I think part of that is that there's less blood flow to the default mode network. So the part of us that plans, that reviews, that thinks about ourselves and criticizes ourselves, all of that is quiet or quieter anyway. And so yes, it is often much easier to be with whatever is most present. And sometimes that's things happening in the body. Sometimes it's more like this very profound process of images moving through almost dreamlike experiences. So it's not always a somatic process, but it often is, especially when you're supporting people in moving in that direction. And I'm so glad it's been helpful for you. And I'll say that I just think it's really important for many people, given where our culture and society is right now and how mind-centric we've become. So helping people to get back into their bodies is just so essential.
Yeah, I used to always say like I could talk to my therapist all day. My nervous system has not gotten the memo. And
Yep.
then I feel as though like this is one way that the nervous system gets to do the talking. It's like, no, it's my turn for therapy. And it brings things out that I would never have come up with had I just been talking.
Yes,
And that's
exactly.
what I love about it. And so I can only imagine adding ketamine to it. So what a very cool opportunity that your patients have. If you'd like to expand on the touch portion.
Yeah, sure. And actually, while I'm thinking about it, there's one other piece prior to touch, which involves movement. So sometimes what our body needs to do is express some kind of movement that either wasn't able to be expressed at the time of the trauma because they needed to move into a freeze or collapse mode. Sometimes it's just that whatever it is that we're holding can best express through nonverbal methods, and movement can be a really good way to do that. And so I'll encourage people sometimes to, as they go into the feeling, allow it to get bigger and see if there's any way that it wants to express itself. And sometimes that looks like shaking. That's one of the most common things, is the nervous system's natural release that wasn't able to happen at the time of the trauma, and so has been stored in there. But it could also look like kicking or pushing or screaming, or all kinds of different things. So just wanted to name that too.
Oh, very interesting. And how do you as a therapist, just curiosity, like keep things safe in the room if they're, start to get physical?
So ketamine really keeps people pretty immobile. They're not generally getting off the couch. So, it's usually them lying down still, but moving in that direction. I'm generally close enough that if they were to fall off the couch or something like that, that I'd make sure that they stayed safe. And yeah, this is actually a really good transition into the conversation around touch.
All
So
right.
maybe I'll go there.
Perfect.
So one of the important places for everyone to start if you're going to offer therapeutic touch is a conversation around consent. And so you talk about consent for touch, even if all you're going to do is what's called safety touch, or keeping people safe, keeping people. So you let them know in the preparation sessions that you will, do what you need to do to keep them safe, and that could include making sure they don't fall off the couch, or making sure they don't fall on their way to the bathroom. And so you let them know and get their consent around that. But then when it comes to other forms of touch, which could look like supportive touch, like a hand on the forehead, or holding someone's hand, or a hand on the shoulder, or what's called focus touch. So the practitioner bringing their hands to a place on the client's body where they have some kind of condensed energy, or where they want to focus their attention. And that can help people to bring their attention to that area, to breathe into it, to feel some contact, which is often really helpful for these places where we're, holding fear, for example, or feeling alone. And then it can also help through that process. It can start to move the energy. So with all of those things, you let people know beforehand what the possibilities are. You hear from them about what kind of touch they feel safe with and where they feel safe about it. You talk about whether they feel comfortable asking for touch if they want it, whether they are okay with the practitioner offering it, whether they feel comfortable declining it. Like, you really want to go through a whole process of making sure that people feel safe with touch. And once you do, I've found that it can be one of the most profound supports or tools to use in psychedelic therapy and in ketamine work specifically. So, you know, I think there are many reasons for it. One of them, I think, has to do with the fact that many of us just don't get enough touch. We don't get enough nurturance. We don't get enough contact in that way. And so feeling the support and the presence in a very physiological way of someone who's there to support you can be healing in and of itself. So that's one piece, is just kind of the nourishment, the relational contact that's there. It also can, I think another aspect of the healing potential of therapy in general has to do with the therapeutic relationship, and developing this sense that there's someone who cares about you, who's there to support you, who's going to um, be that right there with you as you're dropping into your scariest and darkest places. And touch is one of the best ways to communicate that. I mean, a therapeutic presence can be very effective too, but feeling someone right there with you can be very healing. And then, like I mentioned before, it can just help to open up a different aspect of our experience. There's one client in particular that I'm thinking of right now who tends to be very cognitive, very heady. And so we spend a lot of our time, kind of talking at that level. And at a certain point, we both checked in and said, do we feel like this is useful, or are we missing something? And through that conversation, we decided to integrate therapeutic touch into our work. And in our touch therapy sessions, even without ketamine, sometimes we would do them with ketamine, sometimes without. But she would have these almost psychedelic experiences of images coming through. It moved completely from a linear way of processing things to a very non-linear, imaginal way of processing things, where she would have young parts coming to the surface, or she would have an image of a spider, say, and it would take time for us to start to connect the dots and understand it, but it really got to the heart of the matter a lot of the time, where her mind was talking around things.
Interesting. Can you describe what touch therapy looks like in practice?
hmm Yeah, so when it involves a psychedelic medicine, usually the person is on the couch and I'm sitting right next to them. When people are not taking a medicine, I actually have them on a massage table and I'm sitting on a massage stool with them. And I'm trained in therapeutic touch through an organization called Relational Somatic Healing. It's not ethical to touch anyone if you haven't received, extensive training in how to hold it and how to hold it appropriately and with consent, because it definitely increases the vulnerability for the client and the potential risk of boundary crossings. And so it's important to step into it with a strong background and experience and training. But yeah, it's not massage therapy in that you're not massaging someone. Instead, it's light touch, at least the type of touch therapy that I do. It's light touch with a hand, say, on the chest or on the shoulder or the forehead. Sometimes, like behind the back, can be really profound for people, under the kidneys, that kind of thing. And you're holding it there and just really open together to what comes up. And what comes up could be sort of imaginal, like I was just talking about. It could also be relational. Often people have stuff come up in relationship to the therapist because it tends to send people back to earlier stages. Often it's, kind of 0 to 5. And so we're working with those younger parts of people and addressing whatever is, stuck there, whatever areas of arrested development they have.
That's so interesting. Okay, well, fantastic. Thank you for letting people know that if they are looking for that, they need to look for a trained practitioner.
Mhm.
Very, very important. Something else kind of on that same wavelength is body work. And so do you incorporate that with the ketamine sessions as well?
So personally, I do not because I'm not a trained body worker. I'm a psychologist. However, we do have other practitioners at Sage who do body work. And so yes, this is a little bit newer, but we have been moving towards that. And our two body workers have both had begun to practice working with clients. And I have also had gotten to experience this myself. So yeah, it's really interesting and potentially very profound as well.
Interesting. So I assume that's another low dose
Low dose
of
session,
ketamine. Mhm.
absolutely. You want the person to be present and able to communicate with the body worker throughout, letting them know what's working and what's not. One way that I found it really kind of interestingly supportive is as it's ketamine is classified as a dissociative anesthetic, and so it reduces the experience of pain. So I actually, one of our practitioners in the past was a rolfer. And so I was able to experience on the client side of things, having a very low dose ketamine session while he did rolfing work on me. And we moved in that direction in part because he was working, in rolfing, there's a 10 series and you focus on different parts of the body in each session. And so he was working on my feet. And it was so painful, we had to stop and, kind of pause on that work. And we eventually circled back with ketamine, and I was able to just receive it in a different way. Like when the pain gets too intense, and then the body tenses up, and it's not a supportive experience, and you don't want to be pushing against someone's nervous system or pushing past someone's sense of comfort. So the ketamine allowed me to open to the deep work that he was offering in a different way.
That is so interesting. Interesting, interesting. I know you said you at one point had also offered acupuncture with the ketamine.
Yeah, yeah, and I'll just say a couple more things about the body work as
Oh, yes.
well, is that our body workers are also trained in a modality called somatic experiencing, which is a trauma-informed approach to working with the body on a somatic but also a verbal level. And so in these body work and ketamine sessions, people are both receiving body work and relaxing into it, but they're also supported in tracking whatever comes up for them, whether it's any kind of reaction to the touch or images or memories, and then working with what arises as it arises, both through massage, but also potentially through some talk if needed.
Okay, thank you for that extra pit. I love that combination.
Yeah.
So back to acupuncture. I am very, very curious about this because I have been an acupuncture patient for many years in different situations and never had it occurred to me to combine it with low dose ketamine. So I would love to hear what led to that and what kind of things your clients have experienced.
Yeah. So, I mean, what's led to all of this is my personal experience of incredible benefit from integrative medicines after hitting up against a wall with Western medicine. I had some of my own health issues from actually coming off of hormonal birth control. My body just went kind of crazy. And I, went to my OBGYN and she was like, "You're fine. There's no problem here. You're fine." And I was like, "Well, I'm not fine. I'm actually, experiencing a lot of intense symptoms." And so I ended up shifting to integrative medicine, an acupuncturist, a nutritionist, and a naturopathic doctor, and then ongoing body work. I just think body work's so helpful and important for us. And my own psychedelic work. And I really started to feel like this is so helpful. I just wish that all of my practitioners were communicating with each other. So that's kind of where Sage came from, is having all of these different practitioners under one roof who can work as a treatment team and collaborate together around the clients that they're working with. So yeah, it really the idea of combining ketamine with each of these kind of came from my own passion for this work and wondering how they would work out together. And I know that some others outside of Sage do it as well, so it's not like my one genius idea, but I definitely have some excitement around it.
And how does that usually go? So I'm guessing low dose as well. And
So
then first, I'd also be excited to never feel the needles. That would be cool.
I know it does make that part a lot easier. But what's interesting is that it did for me anyway, increase your sensitivity to the energies moving through. So I'm not an expert in acupuncture or Chinese medicine, but as I understand it, we have these different meridians, and the acupuncture needles help to unblock the channels and allow our energy to move more freely. So I, always appreciated acupuncture and felt like it was helping in some way, and I would feel better afterward, and it would help me be in a more regulated state, but I could never really, I never really knew how it was working. And after having an acupuncture and ketamine session, I felt like I had a very clear tangible physiological sense of what was happening there. Every time he would put a needle in, I could literally feel the energy start to open up and these energetic blocks start to move. So that was super profound just to be able to sense into what was happening in that way. And then simultaneously, the acupuncture seemed to open me up to receiving the ketamine as well. Because, I don't know if you've noticed this before in psychedelic medicine work that you've done, either as a client or a practitioner, but often, or sometimes anyway, people's defenses will come up when they step into a psychedelic session, and they there's some part of them that doesn't feel totally safe to let go. And this can be so strong that some people will not even feel it at pretty high doses. It's pretty incredible, the level to which we can protect against the effects of psychedelics. And so the acupuncture can help the nervous system to relax and help the system to open to the ketamine such that we are able to more fully receive the benefits of the medicine and feel the effects of it. So after my first session like this, personally, I found that, and I can only speak to this combination as a client because I don't do acupuncture myself. But the after the first session, I felt maybe more open, one of the most kind of open and connected places that I have been in my life. My heart was completely open. My like emotions were moving through me in this really kind of clear and healing way. And I just felt like I could, feel everything, including like the sense of awe for the world around me. And yeah, it was a really beautiful experience.
Very cool. Thank you for sharing. We're going to move into an area. Well, actually, I'm going to make a pit stop at craniosacral therapy, which I only know just very little about. So if you could tell us a little bit about what it is and how at your clinic you all integrate that with ketamine therapy.
Yeah, I'll tell you a little bit, not my area of expertise, but we have an amazing practitioner who does this work at Sage. And it involves, as opposed to with the meridians that acupuncture works with, it is also working with energetic channels, but also with the cerebrospinal fluid. So the kind of fluids in the body and through somewhat light touch, often starting in the back of the neck, but also moving throughout the body. The practitioner is trained to tune into really subtle kind of movements of the fluids within our body. And apparently, there's a kind of wave-like process that all of our systems have. And through this touch, they're helping the system to regulate. They're helping those waves to kind of normalize and open up. So I don't know if I might be butchering that, but that's my understanding of it coming from completely outside of the profession. And with ketamine, it seems to, kind of similar to acupuncture, really just have this synergistic effect of one opening up the other and the other supporting, and the first supporting the other in kind of the effects of each compounding.
Very cool. I did not know. I thought it was like moving the bones of the head, but that makes a lot more sense that you're working with the cerebral spinal fluid. I
Well,
don't,
and I
go
believe
ahead.
it's actually through holding the bones that you're opening some of that up. So there is an aspect, it's connected with osteopathy and there is something related to the bones as well, I believe.
Okay. All
Yeah.
right. Thank you for that. Now we're into, I think these two are probably pretty interrelated, but I'm very excited that we're kind of rounding out this discussion with them, which is functional medicine and nutrition therapy. And I am assuming that through functional medicine, you may find nutritional deficiencies that you work on with the therapy, or is that, am I just making that up, or is that at all close to how those two might interrelate?
Yes, it is. It is. You can both find nutritional deficiencies and also use nutritional therapy to help people to food is medicine. So to help people to, resolve those deficiencies, to increase certain nutrients that they may be deficient in, also to address all kinds of issues, everything from gut dysbiosis to, fatigue to, migraines. Food can really help with a lot. It's not, the only thing that practitioners use, but it's often a big aspect of the treatment along with supplements and lifestyle changes, behavioral changes, and sometimes medication as well. But yeah, the ways that we use it in integration with our ketamine therapy practice is multifold, actually. One piece is that the as much as I think that a lot can be supported through psychotherapy, through psychedelic therapy, through addressing the mental health aspects of things. There's also a lot that's rooted in the physiology in the body, and that simply can't be addressed through a psychological process. Whether it's a nutrient deficiency or gut dysbiosis, like I said, or, there are a number of things that are, held in the body. And while it's all connected, addressing it at a bodily level can be very supportive. So when we have clients come in, we let them know that this is available as an option and often encourage people to work with our nutritional therapist and functional medicine practitioner, same person, to get a sense of what's happening at the bodily level. So yeah, it does involve running certain labs, and she'll talk to people to get a sense of what they're dealing with, and then help them choose the specific labs that are going to be most helpful for them. One really common one that we use is called the GI map, which looks at the gut, everything that's happening in the gut, because so many people have, issues there, bacterial imbalances, or, there are all kinds of different parasites that could potentially be impacting people. Um, yeah, lots of a lack of stomach acid, just lots that could be happening there that affect people on multiple levels. We talk a lot about the gut-brain barrier and just how the two are so interconnected. And so that, for example, can be really helpful. Different blood labs just to check on levels of different minerals and neurotransmitters, hormones, that kind of thing. We also could potentially do a hair test, which is really interesting. It shows the minerals that tend to stay, like where a blood test is just going to give you a snapshot of what's happening in this moment. A hair test is going to give you a sense of what's actually there longer term, like over a series of months, for example. There are urine tests, there are saliva tests. So anyway, she'll decide on which tests are most useful for what it is that you're dealing with, and then help you get to the root of whatever your symptoms are. And personally, this has been really important for me and my own healing. I hit a period of burnout that ultimately led to chronic fatigue and terrible insomnia. And it was only through a process of ultimately functional medicine that helped me identify what was underlying that and get to a place of now I'm sleeping 7 to 8 hours a night every night, which has been so helpful. So all of this to say that it can be a really supportive way of understanding what's happening at a physiological level that may be contributing to people's symptoms of depression or anxiety or insomnia or, whatever else it is.
I love that because I have this discussion with patients in our clinic is that if, like you said, one thing you brought up that you test is hormones. And I'm like, if your hormones are completely out of whack, then what we're doing with the ketamine is just kind of like trying to put a band-aid on a storm that,
Yes,
could we get the storm settled down first? And then the ketamine would be much more effective. Um,
exactly.
and also just remembering that every time that a patient comes in, they're a different person, right? Especially women, depending on
Hmm.
what time of the month they come in, they're a different, at a different status of hormone levels. Somebody in perimenopause could be by the second, right? And
Hmm.
like it's so important to keep all that in place. Or you also mentioned things like thyroid. If your thyroid is all out of whack, again, you're just working, the ketamine can only do so much. So I love that you offer your patients an opportunity to get the body tuned up so that the ketamine can be as beneficial as it can be.
Yes, yes, for sure. And then the other way that I guess turning more towards nutritional therapy, the way that that can be helpful is both before the ketamine session. Sometimes it can be helpful for people to do a sort of dieta, like similar to in ayahuasca ceremonies. I mean, it can be a bit more sort of strict, for an ayahuasca ceremony, in part because of the interaction between the medicine, where ketamine doesn't really have that with foods. But there is something about bringing the body into more of a grounded and healthy and open place by eating, kind of cutting out anything that's going to cause indigestion or bloating or mood swings or, not sleeping, like alcohol, for example, or sugars or processed foods. And also a kind of honoring of the experience that you're stepping into. And so a nutritionist can really help you to think about what's going to be most supportive of your system as you step into this, not kind of letting go of any nutrients that you need while also helping you to kind of cleanse as you're stepping into the experience. And then on the other side of a medicine session, people sometimes come out with some clarity that, like, I really need to, clean up my life or clean up my diet. And so a nutritionist can also be helpful in the integration and implementation phase of just helping people think through, how do you want to actually take steps towards improving your nutrition in a way that feels doable and sustainable.
I love that. I really appreciate all the work that you and your staff have put into finding ways to integrate all these things together to support the patients and clients. Have I left anything off of our list that you wanted to discuss before we wrap up?
Let's see. I don't believe so. I think we've covered all of the modalities that we're, currently working with and that I'm most excited about at the moment. Yeah, it's been
Okay,
been fun to share
great.
all this with you.
Well, thank you. Can you tell people more, maybe they're in the San Francisco Bay Area, more about where they can find you and learn about your work?
Sure. So yeah, I am at a clinic called Sage Integrative Health. We're in Berkeley, but we also serve patients in person throughout the Bay Area, but also throughout California too, virtually. A lot of our work, including ketamine sessions, can happen virtually. We discovered that in COVID and found out that some people really like doing ketamine sessions from the comfort of their own home. So yeah, that one's totally possible. And yeah, feel free to reach out. Or our website is sageintegrativehealth.org. I imagine you'll put that in the show
We
notes.
sure
And
will.
and yeah, I'm always happy to hear from folks, whether they just, whether they're sure they're interested in our services or just want to, let me know about their situation and think through what might be a good fit for them. I'm always happy to provide referrals, whether it's within Sage or within my wider network.
Amazing. Thank you so much. I really appreciate you everything you shared with us today. And for everybody else out there, until next time.